You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, we're talking about freezing fat. It's the new liposuction. It's called CoolSculpting. With us, with board-certified plastic surgeon, Dr. Robert Graper. Dr. Graper, welcome to the program.
Randy, thanks for having me.
Now, you brought some photos.
I did.
And we'll start off with this, this whole fat freezing, this technology. They're calling it the new liposuction, may replace liposuction in many cases. Does it work?
It absolutely works. After more than 1 million treatments, there is scientific evidence, photographic evidence, personal testimonials. It absolutely works.
Okay, we were talking in the green room about technologies, and you don't like the ones that don't give results.
No, in plastic surgery, the commercial people are always trying to bring us treatments that they can sell us. And so we've become very jaded, and we don't really believe most of them are going to work, because they don't. In the last 20 years, there have been two that have worked. This IPL machine that takes care of red spots and brown spots with light therapy absolutely works, and CoolSculpting.
It does work, okay.
The first time I heard about it, I thought, yeah, right, how are you going to get rid of fat just freezing the skin? But it turns out a couple of PhD MDs at Harvard observed patients that would get atrophy in their fat cells. And these were little kids with dimples in their cheeks, and they couldn't figure out how was happening. Well, this atrophy was occurring because of the coldness, and chance favors the prepared mind, and they just understood that the cold was killing the fat cells, inducing programmed cell death. And from that, they expanded on that and took it to CoolSculpting and using it on other areas.
Okay, good. And this is, we're here in California and San Diego. It's sweeping. This is like the hot topic.
It is.
So it's going on where you are too.
Absolutely. Nobody wants to be operated on if they don't have to be. And CoolSculpting gives them a safe, affordable, quick way to lose as much as 22% of the fat in the area involved. That's incredible that it absolutely works. I think that's one of the big barriers that people say, I'm not doing that because there's no way it's real. It is real.
I asked you on the phone, who should get this? And you said anybody over 40 or something like that.
Anybody. How many of us don't have areas of fat that we'd like to get rid of? You go in a room of 100 people, there might be one or two that are truly thin, and maybe even too thin. But that's one or two out of 100. The rest of us all would want some fat removed. And if you're trying with diet and exercise and it's not working or not working as well as you'd like it to, this is a great alternative. Why not?
So the fat is frozen and the fat cells die. So like lipo, it doesn't come back.
It's exactly like lipo, but in a kindler, gentler way. Lipo is the gold standard. It's going to produce the most results. It's going to do immediate results, but there's more cost. There are incisions. There's anesthesia.
You do lipo, right?
We do lipo every day. It's the #1 procedure because, again, so many people have extra fat. But, for instance, men, for whatever reason, aren't going to do surgery. Most of them. Probably 10% of them will do it. But they will come in every day and sit down and read their emails or watch a movie while they undergo an hour treatment of freezing the fat. And they get 22% of their fat removed.
What about you? You had it done, you said.
Absolutely.
What areas?
I did tummy and did hips.
Really? Hips?
Yeah, hips. The love handles, as they say.
And you saw results?
Absolutely. It was funny. I was on a trip with my wife, and we're taking pictures. And I got home and I saw one of these pictures. And went, "Whoa, is that real?" And she went, "Yeah." So I'm going to the office, and I've got an RN that does this for me, and she's very thorough and does a great job. And put those things on, and I did emails and
does it hurt? It seems painful. It's grabbing onto the fat. Is that right? Like your love handles?
Yeah. What the technique is this? There are the device, and they're different size devices, and it is a combination of suctioning the tissue up into that device, which then freezes it. And the device is in a U shape, so the cold's coming all around it. And it does that suction so fast, and it cools it to 4 degrees centigrade so fast, it's numb like that. And, it's on and you go, whoa. And then there's nothing. It's just so cold, it's numb.
So you get numb to it.
Yeah. And then you're an hour just like that. And you can do other things at the same time. Like frequently the nurse will do some Botox while somebody's got an hour to spare, or they'll do some fillers while they got an hour to spare. We haven't done any surgery yet while somebody was doing CoolSculpting, but I guess it's possible. But then when they take the machine off, the tissue is massaged out, and it's very cold. It's like if you put a washcloth in a freezer, it'd come out very cold, and you massage it out, and it gets flat. But then right away afterward, I went out and hit golf balls and pumped iron. I mean, it was nothing. I didn't take any pain meds, nothing. The results were great. My clothes fit better. I feel better about it. You know, when I see pictures now, I don't have that problem.
Because you're a lean guy.
You feel, yeah.
Like when I look at you, I don't look at you as a guy that needs this. But everybody, I guess, has that.
You know, clothes are very generous, and if you're trying to look good in your bathing suit and look good for your wife, same thing goes but for my wife. She's had it as well.
Oh, she did this.
She's done it as well. She does yoga 5 days a week. She is a beautiful woman and a tremendous figure. But, she's had 3 children, and she's got some genetic areas like we all do. I think she did her inner thighs because the rest of her was fine. And, it fixed a problem that had bugged her for years. And she's a pretty happy person all the time, but, that made her feel good about it.
Okay, good.
So she's glad I had the CoolSculpting.
Now, you do more than just CoolSculpting and liposuction, things like that. For people that don't know your practice, tell us a little bit about your practice, who's your typical patient, and what services do you offer?
Well, I'm in Charlotte, North Carolina. It's a great town. We have full service cosmetic surgery practice.
And you do all the plastic surgery procedures? I mean, breast and tummy tucks?
We do all of those things. But, if you're going to have a full range of plastic surgery practice, then you've got to have a skincare department. You've got to have fillers and Botox, which we have 3 RNs doing that. So people come in and don't like their frown lines. They don't like their smile lines. They're happy all the time, but they don't want to look like they're smiling all the time. They want to erase some of those ages. We actually call it a liquid facelift. And then, of course, we have a surgical suite in the office. It's accredited, and we do
an operating room.
An operating room with overnight capacity for those that want to stay.
Facelifts. We talked about this.
Breast surgery, all the things.
You're like the natural look. You like a natural looking facelift.
Exactly.
One that nobody knows.
Well, Randy, you don't want to look different if you get a facelift, which you don't need, but, someday maybe you'll call me. And you don't want to look different. We don't want to look different. You want to look like you did 5 years ago or 10 years ago. You don't want to look like your brother Steve.
Do women say that? They don't want to look done?
All the time. They don't want to look done. They don't want
like the people in California. Do they say that?
The stars, yeah, you are attuned to this. They don't want to look like different people. They want to look like the same people, but younger, fitter, healthier. And through all that range of services, the skincare, the Botox, the surgery, that's what we try to achieve is a very natural, normal look. Normal's important.
Okay, good. So moving on, and for people just tuning in, we're talking about freezing fat. I called it the new liposuction. So you think this is the next big thing?
It's the next big thing, and it's still really not discovered yet. Because if it was really discovered, there weren't enough machines out there to take care of all the patients that would want it. I think people either don't know about it, and that's one of the reasons we're doing the show, but also they don't trust it yet. They don't believe it yet because it's too good to be true that you could, in an hour and with no recovery time, fix this problem at a very reasonable cost.
So with one or a few treatments, I mean, if you have love handles, you could wipe them out.
You can wipe them out. And 22% of the fat is the most you'll get per treatment. But
so you can do multiple treatments.
You absolutely do multiple treatments. And unlike surgery, you're not going to go back to surgery and have anesthesia and that recovery time. Nobody's going to do that. You want to do everything at one time. But with CoolSculpting, it's so scalable. You could literally, though people don't do this, you could come in and if you only had time for one hip, you could do one hip one day. You could come back and do another hip another day because the results are going to take time to show up and it will all blend together beautifully.
Now, you're not new to this, right? You were like one of these early adopter
We were one
physicians.
of the, yeah, I mean, we've had it for 4 years and done, we're up in the company ranks of numbers of procedures. And so I don't want to brag too much, but yes, we were in early.
And for some people, by the way, you say this could be life-changing. Elaborate on that.
Oh, I mean, Randy, how much time have you got?
Okay.
You know, everybody's bothered by something, and most of it, a lot of times it's fat. And so the clothes that you can't wear, that you want to wear, the clothes that you've already got that won't fit anymore, and people will come in and say, I want to get into that little black dress. You know, I've got a big party coming up. I've got an engagement party. Maybe it's my own engagement, or maybe it's my son's engagement. I got to get into this dress. We see that a lot. We see a lot of, you know, I got a closet full of clothes that I love, but I can't wear. And then we'll start working on it. We'll start working on tummy. We'll start working on hips. We'll start working on inner and outer thighs. And they get there. And it's easy. And they can take their time doing it, or they can do it all at one time. And you know, you might need to do one area 1, 2, maybe even 3 times. You know, talk about transformations. When people have something they don't like and it bothers them, they may know it bothers them, they may not know it bothers them, but it's holding them back. They're not living life to the fullest. They want to be more, but they can't get past this thing. And unfortunately, sometimes it's a physical thing, but fortunately, we can fix it. I remember a young woman had a nose she didn't like, and it wasn't a very good nose, I got to admit. And so we operated on her nose, and it changed it to a very normal, pretty young woman's nose. And she went from a wallflower to the debate team and the cheerleading squad, and she just blossomed incredibly. And, you know, should it be that way? I don't know, but it is. And to be able to help people make that transformation is fun every day.
So what are the most popular or common areas that you're treating with CoolSculpting?
Well, the most popular are abdomen, where you'll get a mommy who's had a couple of babies, and she doesn't like what the residual fat that it's been left over with. And if it's always the problem is fat, then CoolSculpting works great. And frequently that mom doesn't have time to go in and have liposuction, but she's got time to take an hour for herself and come get that treated with CoolSculpting. Inner thighs are very popular. You know, ladies don't like it when their inner thighs will touch and they're walking and it makes a sound. It bugs them. And, you know, you and I don't even notice it, but they do. And to treat that is liberating. Outer thighs, very popular.
So saddlebag area, when you talk about outer thigh?
Outer thigh or saddlebags, yes. And that's very popular. That didn't used to be treated, but there's a handpiece now that works great. Takes a little longer than the traditional 1 hour. Takes about 75 minutes, but it works very nicely.
So they can read a book or whatever?
They can read a book. And, you know, I think in many ways it's better than liposuction because it's very smooth. You know, there's the yoga person or the athlete who they work out, they diet, and they've just got body fat that's resistant to diet and exercise. That is the perfect candidate.
Like genetically, they just have that little
they,
area
you know,
on the saddlebag.
Everybody deposits their fat differently. And, you know, on men, it tends to be intra-abdominal, but on women, it is, you know, tummy, it's saddlebags, it's hips, it's inner thighs. Rarely it's breasts. And so when you get an ideal candidate, everything else is right. You know, the face is right, the chest is right, the bottom's right, but they got a little tummy, or they got a little bit on their inner thighs that they don't like. And you don't want to make everything else get worse with diet and exercise because it's getting too thin now. You want to just treat the problem because it's the one area that's a problem. Everything else is fine. That's the ideal candidate, not the person who comes in 20, 30 pounds overweight, although CoolSculpting will help them.
Because it still kills the fat, right? No matter what size you are.
No matter what size. And 22% of a big tummy is more fat than 22% of a small tummy. You know, your results are better if you're an ideal candidate, because if you're 22 pounds overweight after CoolSculpting, you're still 20 pounds overweight after CoolSculpting.
Okay, so if a woman goes in, and we're talking about women and men, but if somebody goes in, let's say for the
Men do this.
They do?
Oh yeah. I mean, men are
Real men are coming in?
Real men are coming in, and men are probably going to be the bigger market because men, again, for whatever reason, are less likely to have surgery. You know, women have babies, they have, you know, procedures that are for the gynecological procedures. Men don't have any of that, so they're not experienced with surgery. They're going to be the big users of this.
Okay, so as you said, you say that pretty much people know, the word on the street, I'm paraphrasing, that liposuction works. And they're skeptical about this, even though it's not new to you, you've been doing it for 4 years, that they're skeptical that it works. Do you give, like if you do those love handles, I mean, do you offer any kind of a guarantee?
Who told you? Is it out? Yes, we have a guarantee. I don't know.
So you do have a guarantee?
We have a guarantee, and it's that if you don't see noticeable results in your clothes or photographic results and you've maintained your same body weight, we'll do that area again for free because you're going to have results.
Okay, we're going to take a quick break. We come back, and you brought photos.
I did.
You're very proud of these. They're like baby pictures.
They are like baby pictures.
And you're watching The Wellness Hour. I'm Randy Alvarez. We're talking about freezing the fat. We'll be right back.
The ideal candidates for CoolSculpting are those people that have stubborn pockets of fat that are resistant to diet and exercise. The love handles, muffin top, so-called spare tire, these are the people that really do best with CoolSculpting.
CoolSculpting only took 1 hour. 1 hour, no general anesthesia, no local anesthesia, no pain. 1 hour, in, out, bing, bang, boom, done.
It's been really nice because I feel like I finally have gotten back the body I had 15 years ago when I was in college, and I didn't expect that from the procedure.
After I had CoolSculpting done and saw the results that I had, I've definitely recommended it to a few people, several people at my gym that have the exact same issues. They work out 7 days a week, but there's still some areas that, regardless of how much they work out, it's not gonna go away.
I feel confident in a two-piece bathing suit. I haven't had a two-piece on in years, and I can walk around with it on. I have a form-fitting dress on, and it just slinks off my body. So when I walk down the street, I feel confident, I feel strong, I feel sexy, I feel beautiful. CoolSculpting is probably one of the best things that I've ever done.
I knew that I wasn't going to be able to make it to the gym as often as normal. I looked into it, and it seemed like the price was reasonable, and it wasn't one of these things that was going to cost so much that I wasn't able to afford. I've had 2 CoolSculpting treatments, and I'm looking to do my third sometime next week. If you decide to do it, I think it's a good investment. I really do.
You're watching The Wellness Hour. I'm Randy Alvarez. We're talking about freezing the fat with board-certified plastic surgeon, Dr. Graper. Dr. Graper? Okay, so you brought some photos.
I did bring some photos, and these are evidence that this works. This is the real deal.
All right.
So, Randy, this might be you. This just might be you. Here's a man who's got a little extra on his hips. Probably not you, but it could be you. And, you know, he doesn't like it. He's not going to do surgery because he's not going to do surgery. But for an hour, he'll sit there and have his fat frozen. And you can see the results on his hips. It is a definite improvement. His clothes fit better. He's happier about it. He may do it again, but at this point, he's very happy. So you can look at this photograph of his after results, and he is so much more narrow afterwards. And you know that's just
true.
one treatment. He is
more narrow
on his. The bumps on his hips are much smaller, and he's much more narrow. And that's what he's looking for. Now he can, you know, that particular patient was transformed by that. He got energized to go out and exercise more. That's, you know, ideal. If you feel better about yourself, you're motivated, then you're going out to the gym more and you're taking the weight off.
You're tucking in your shirt.
You're tucking in your shirt. You're taking off your shirt, Randy.
And so those fat cells are gone. And
they're metabolized. They enter into a programmed cell death. It's not more than 22%, but as much as 22% each time you treat. They die over the next month. The body metabolizes them. The inflammation comes in and rids the area. The area loses volume because the cells are gone forever. And all that fat's metabolized in the liver. There's no elevation in the cholesterol and no elevation in the lipids.
So somebody could, let's say, I mean, if they wanted to get rid of all that saddlebag or all those love handles, they could do multiple treatments. I mean, could you get rid of all of it?
Yes, in fact, we've got a picture we can show you. This is a patient who came in multiple times, so you can come in more than once. You can treat the abdomen, and in her case, we treated her abdomen 4 times. Now, technically, you can put one large CoolSculpting device on, or you can put 2 smaller devices in each of the quadrants of the abdomen. That's starting to get some sculpting going on. So we've gone from early CoolSculpting just treating a patient to now transforming them with literally etching them and sculpting just like you do with liposuction. Randy, look at the before. There's a big thing of fat, of adipose, of
big
pannus
roll.
there.
It's a roll.
And afterwards, now that's several treatments, but it is dramatically better. And for a 68-year-old who wasn't a candidate for surgery, that's a miracle.
That looks like a flat stomach.
It looks like a flat stomach.
Is she sucking it in?
Sculpted. No.
Is that right?
She is not sucking it in. We tell them to make it look as bad as it can be on their pre-op and on their post-op. Well, and look how flat it is afterwards. And, I'll tell you a funny story. She looked better in her clothes. She liked all that. But what she really liked the best was her grandchildren didn't come up and grab her fat. They use it as a pillow and they grab it and they tease her about it, and they can't do that anymore. And, she loves that.
So are the patients younger and younger, getting younger and younger over the years, or older and older?
No, I mean,
she's 68.
She's 68. It's a wide range of patients, because there are young patients who come in and they've got extra fat, and either they don't want to diet and exercise, or they're doing it and it's not working. They're candidates. You get the older patients who aren't going to have the exercise tolerance. They're not going to have the cardio ability to work off the fat. They're candidates. The older patients, or really any age patient who has a medical problem, they can't undergo anesthesia. And so liposuction is much more difficult for them, and they're no problem with CoolSculpting.
On this lady right here, the 68-year-old, because a dramatic result, she looks like she'd be a good liposuction candidate. Did she not want lipo?
She had a medical condition.
Okay.
Yeah, she had a medical condition, and anesthesia wasn't interested in putting her to sleep, and I don't want to do anything that's not safe, and nor does she. And when CoolSculpting became available, she jumped right on it. Here's an inner thigh photo. I want you to look at her inner thighs. Look at the before and after difference. In a bathing suit, that's huge. When you're at the pool with your kids, when you're at the beach with your husband, and your self-confidence and knowing you're rocking that bathing suit, it makes a difference. It makes people happy. And that's the fun thing about plastic surgery. You can make people happy.
So that inner thigh,
oh yeah.
I mean, is that a tricky area for liposuction?
It can be. If you get lumps there, you notice it'll bug you every day.
Well,
and the CoolSculpting's smooth.
And anybody that's been to a gym knows that a lot of women are doing that inner thigh machine.
Oh yeah.
So this can hit it. I mean,
works way better
you could
than
keep
inner thigh
going
machine.
and keep going and just hit all the fat.
You can hit it until it's smooth the way you like it. It's infinitely scalable. The scalable part of it is interesting because you can keep doing it. Not like you keep doing surgery. It's too much trouble and hassle and risk. But this, you can keep doing it till you get the results you want. But also economically, your resources may not be as good as you'd like them to be, and you've only got resources to do one thigh at a time. You can come back when you got your resources done. You wouldn't do that with surgery. If you don't have enough courage to do the surgery, you can come in and do CoolSculpting.
But is the most popular, like right around that belly button area? Like to hit that flat, or is it just a combination of everything?
It's what bothers you, and if your outer thighs are a problem, you do your outer thighs. Sometimes it's the whole thing, because you're really trying to treat the transformation. So that means tummy, it means outer thighs, inner thighs. So here's another one of the inner thighs. Huge difference. Now you got to, the picture isn't all that great, but it's a clinical picture. It's what we use to document our results. So it's not a marketing.
It's not
picture.
A flattering photo.
Yes, but it shows the results.
Her inner thighs, are gone.
Much better. And that means the world of difference. If that's the thing that's holding you back, and you're not using you're not feeling the way you want to feel about life and living it, and your inner thighs bug you every day. People come in and say, should I have this done? And I go, how often do you think about this? Because if you think about it once a month, I don't think I'd bother. If you think about this every day, absolutely, CoolSculpting is a reasonable thing to do.
Now, you're a plastic surgeon, so when you're out and about, is this one of those things where people want to know? They're asking questions about it? Like you say your wife, like her friends that are saying, hey, does this work?
Oh, yeah. Well, my friends are calling and saying, come on, this can't be real. And they're coming over and finding out it's real.
So have you done some friends? Had CoolSculpting?
Absolutely. I mean, why not?
Because you've had
They
it,
say, what's the downside? And I say, well, you're going to lose an hour, maybe two, depending on how much areas you want to treat. But, the cost isn't very much. There's no downtime. You can go, to a business meeting or a party or whatever you need to do right away afterwards. You can leave our office and, go to the event. Randy, do I have time for a few more?
Yes.
All right.
2 more.
All right, this one's a little bit racy, the story. Okay. I don't know if the show will handle it or not, but it's a good story. All right, so this picture shows a mom, and she comes in with a tummy she doesn't like, and she's had some babies, and, is not feeling so great about her figure anymore. And we treat her, very nice result, and as she's Had her last follow-up visit about 3 months later. We said, well, do you like this? How did it change your life? And she goes, well, I don't know if I should tell you this or not, but yeah, I was really embarrassed about how I looked, with my husband. And whenever we were together, we'd turn the lights off. And he was like, why would we turn these lights off? She says, now I turn the lights on and I'm prancing around. And I think she really loved it. I was kind of proud that she shared that story with us because it's kind of personal. Look how flat that postoperative result is. I mean, it's pretty incredible. That is non-surgical. There's no lipo there. There's no tummy tuck there. That is flat. How do you do that?
That's very nice.
There's no mirrors there. There's no smoke. There's snowflakes. It's cold.
Is it more women than men right now?
Well, everything in cosmetic surgery is more women than men. I mean, women are brighter than we are, Randy.
Okay.
If you don't know that, they are. And there are beautiful people. Everybody pays more attention to them than they do us. But, it's about 90-10 with females, males getting the treatment now. But I can see it rising as the men realize there's no surgery and the guys that are working out in the gym or the guys that aren't working out in the gym and are just too big and they realize they get a simple solution. That is the fastest growing part of CoolSculpting is men.
Knowing you were coming on the show, talk to a few people about this. And because when we talked on the phone, you convinced me this works. And I was thinking, could it be that easy?
I got one in my car. We can go out there.
You got a CoolSculpting in your car. If you did, I would take you up on it. So it is that easy.
It's a no-brainer.
So
you hear about
the
these
machine
no-brainers.
grabs onto the fat,
on the fat.
abdomen.
Yeah, and it sucks it up in there and it freezes it, and you just stay put
could
for that hour.
whatever.
You're sitting in a comfortable chair, watching a movie, reading emails, working, whatever you want to do. It's shockingly how easy it is.
And for the areas like inner thigh and outer thigh love handles, then it's more of a flat kind of a plate?
The plate is curved for the abdomen. It's less curved for the inner thighs. It's less curved for the hips, but for the outer thighs, it is flat.
So outer thigh, I mean, what's your favorite place? If you had to say, the favorite place is this place.
My favorite place is what makes the patient happy.
So we are out of time. Final message though, somebody that maybe has certain fatty areas, but who should get it? I mean, who should absolutely get it?
The person who is bothered by fat, that it changes their life every day, and they've got it extra on their abdomen, on their hips, their inner thigh, their outer thigh, and it bothers them. This is a simple, effective, fast, reasonably priced treatment that absolutely works. And if you don't get it, you're cheating yourself.
Really?
It works. It works.
You'll feel better about yourself.
You will feel better about yourself.
Good. All right. Well, thank you for coming to the show. It was
Thank you, Randy.
excellent. Great information. They can go to your website, find out more, get an appointment, and go from there. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.